What is up, you guys? Welcome back to the channel. My name is Rachel Graham and I'm a registered nurse and I'm a digital creator and a mom. And today I'm going to be talking about dermal fillers. So how they work, what's inside, what are the ingredients, and what you need to know. In case if you've already got filler before or you're curious about getting filler, I want to help you separate facts from fiction and really give you a pretty concise but short 8 minutes or less video to help you make an informed decision about whether filler is something that you want to do or not. So, because I've considered it myself, and I'll just preface this by saying I am not coming in here saying this is what you should or shouldn't do. It's just a very objective viewpoint. So what are fillers? So they're injectable substances used to restore lost volume and smooth wrinkles and enhance facial features. So lips and cheeks are the most popular, for sure lips, but people also get filler in their jawline as well. So botox is the other big one, but that's not a filler, that's a muscle relaxer. So it freezes movement, whereas fillers add volume and they add shape. So just think of them as like a plumping agent, whereas botox is a muscle relaxer. So when do people typically start getting filler? Well, it's usually in their 30s and 40s. There is people in their 20s that get filler as well, obviously, people of all ages, but the most common demographic is 30s and 40s because that's when you start noticing things are changing, right? So what's in your filler? So obviously not all fillers are created equally. There's fillers on the market that I'm not going to discuss here, but the two biggest ones, the first is hyaluronic acid. So that's your Juvederm and Restylane. Those are the two most common brands. And hyaluronic acid is actually a sugar molecule, so it's naturally found in your skin and it attracts water to it. So that's how it plumps. So it gives you sort of this hydrated, youthful look. And the best part about that one is it's actually reversible. Okay. And then we have number 2 is calcium hydroxylapatite. Yeah, it's weird. Radiesse, that's the brand. So this one is crazy. It mimics what's found in your bones. So it gives this stronger lift. It stimulates collagen, but it's not reversible. So you really have to have a good practitioner. And then we have poly-L-lactic acid, and this is your Sculptra. So this isn't typical, but this stimulates your body to actually create more collagen over time. And the results build gradually, and they can actually last for a long time, up to 2 years. Number 4 is PMMA or Bellafill. This is a semi-permanent product. It contains microspheres that stay under your skin for years. It is very effective. However, it's not necessarily the best choice for a beginner. If you go into the clinic, they're not going to immediately be like, this is what we're going to do. So how long does filler last in your body? So like metabolism, it's really going to vary from person to person. Some people will break down the product super fast, others maybe not. Factors like age, genetics, metabolism itself, and then lifestyle choices. Like how often are you out in the sun? Do you smoke cigarettes? Those things will greatly affect how fast your body actually metabolizes that product. So what are the risks that you need to know? So, I mean, fillers, and I don't have any fillers, okay? So I have nothing done on my face. So fillers can look really amazing. I can't say anything from personal experience, but when I see it, when they're done right, it's like, you don't really know. You're like, something, I feel like she could have fillers, maybe, I don't know. So what are some of the common side effects? So this is redness, swelling, bruising, and tenderness. That makes sense. Those are very normal. Those usually fade within a few days. That makes sense. If you're sticking a needle in something, it's going to be red and irritated, right? Some of the more serious risks are going to be like vascular occlusions. So that happens when the filler is accidentally injected into a blood vessel. So it actually physically blocks the blood flow and it leads to the skin dying or necrosis. So in rare cases, that can actually cause blindness. It's super terrifying, but it's actually preventable as long as you see a very skilled injector. So another thing that can happen is the filler can migrate. It can shift over time, especially around the lips or if you get it in the tear troughs, which can create kind of a puffy or uneven look. There can also be infections. So anytime there's a break in the skin, you have a risk of infection, even if everything looks clean and tidy. And then we have granulomas or nodules. So these are small red lumps that can form in your body, not red, sorry, small lumps. And that's your body reacting to that filler material itself. So how do you, if you really want to get filler, you're super dead set on it, how do you avoid some of these side effects and make sure you stay safe? So like I said before, choosing a licensed, experienced injector, a board certified provider is probably ideal, is key. And then obviously asking them what type of filler they're using and why. Why did they make that choice? Make sure they use a septic or sterile technique. And if you don't see it, call it out. And then, yeah, just avoid getting filler at things like parties, pop-up clinics, or like sketchy basements. Like, just don't do that. And I would honestly stick with the HA-based fillers, the hyaluronic acid, because those can be dissolved, right? So in the first time you get injected, the lips really puff up. I worked at a med spa briefly, so I did see that. Like, people get scared, but it's like, ah. So why wouldn't you want to get filler? Well, because maybe you just see like wrinkles and fine lines as like part of the aging process, right? It's just, it means you have wisdom, and it's like, I don't know, it's just like you're aging naturally. And maybe you want to avoid uncomfortable procedures. You want to avoid any kind of potential allergic reactions. So there's lots of reasons why you might want to avoid it. Some other things you can do: microneedling, platelet-rich plasma, laser therapy, ultrasound tightening. So these things may stimulate collagen production, which actually help reduce fine lines and wrinkles, and then tightening and lifting the skin without the need for an injectable. Obviously, balanced diet, regular exercise, adequate sleep, and water. And then for your skincare routine, if you want to add something topical, a gentle cleanser, and then a moisturizer that has a sun protectant and SPF in it. So sort of to wrap it up, I mean, fillers are obviously really effective if done well. So education is key. Making sure you are going to a licensed provider, and making sure, like, keep up with your lifestyle. I mean, if you're going to get filler, make sure you're eating well, make sure you're exercising, make sure you're getting enough water and enough sleep, because those are the things, like, it's got to be from the inside out. I mean, I've chosen to not get filler personally, and here's the little story time, just because I feel like if I look the way I look, that should be good enough. You know what I mean? If I'm exercising, I'm eating well, I'm drinking water, I'm trying to get enough sleep, I'm spending time with friends, I'm having new experiences, I'm laughing, I'm loving, I'm practicing mindfulness, I have a spiritual life, I am really focused on not ingesting toxins like a lot of refined and processed foods, like alcohol, I'm not smoking cigarettes. If I'm doing all this stuff and this is how I look at 40, I think I'm okay with it, you know? But am I opposed to, who knows, maybe in 10 years, I'm going to be like, you need a little something in there. Like, things are looking a little, I'm not okay with it anymore. I'm not willing to say my opinion will never change, because it might, you know. But I think the era of like the overblown duck lip is definitely gone. I haven't been seeing that as much. I feel like I've noticed, you know, lips that you don't know if they have filler or not. You're like, did she just get really lucky, or is there filler in there? So, and you know, I wear lipstick, and I can kind of like draw a little bigger on the top than what I actually got. And there's so many, like, you know, plumping, like, what was her name? Kylie. She had the gloss plumpers. Like, there's so many things on the market that can help sort of amplify things. You know, it's like getting a boob job. Do you need a boob job, or do you just need like a push-up bra? Like, you know what I mean? Like, do we really need to do like these surgical procedures? But having said that, no shade against people that do get fillers, or any other cosmetic procedure. I hope this video was informative. If you liked it, then like and subscribe, and I'll see you in the next one.